going on, world? Welcome, welcome, welcome. Hey, today is Friday. Yeah, I'm just as surprised as all of you. But yeah, today is Friday. You already know what we're doing. We're doing NCLEX questions. NCLEX questions today on this Friday. Why? Because why not? Because we're always putting in that work. You want to know why? Because the NCLEX is always here. So you already know what to do. I need 1,000 likes. And I need 100 followers. If I don't got either or, we ain't going nowhere. Y'all think I'm playing? Hey, and yesterday was officially Black History Month. So I need all of y'all who it applies to just to go on vacation. No, I'm just playing. But what's up, Amber? How are you? Hey, you guys already know the deal. We're doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. Got these questions off nurseslabs.com. They're free sets of questions. Make sure you guys go over there and check those out for yourself. But hey, you guys need to share. You guys need to follow. You guys need to like. If I don't get 1,000 likes, and if I don't have 100 people in here, we ain't going nowhere. That means y'all just going to have to sit here and just ask me questions the whole time. What's up, Ebony? I see you. Ebony's a frequent flyer, so shout out to you. Hey, anybody pass NCLEX? Anybody pass NCLEX like since Wednesday, since we last spoke? So I know we had a whole bunch of folks that did. Hey, how are you? It says brand new nursing student here from Texas. Shout out to you. Is it Chalet? How are you? Hey, I live in Texas too. I live in San Antonio. That's why I was like, hey, where are you from? You know, where are you at in your nursing journey? Let me know. And I'll talk about where I came from later on down the line. It says, guess who's back? Back again. Oh, it's Manasa, y'all. Hey, in case you guys don't know, Manasa, one of the homies, a very good friend of mine who is now about to do her thing, going to New York, you know what I'm saying? So shout out to you, Manasa. Manasa's going to be up in here moderating, make sure y'all don't act up. So yeah, hey, keep smashing that like button. Hey, we need 1,000 likes and we need 100. I got 100 people up in here. There should be no reason why 100 of y'all at, 10 slaps at a time. I ain't got 1,000 stuff up in here. You know what I'm saying? Okay. You're from Maryland. All right. So shout out to you. Where else is everybody else from? Hey, as soon as I got 1,000 likes, I'll turn this camera around. I ain't going to gatekeep. I'll give them to you. I got my license. You know what I'm saying? If you want yours. Oh my God. Is that a gray hair? Oh, thank God. Woo. That's a dog hair. Let me just tell you. All right. Hey, we got 1,000 folks up in here. Shout out to Haiti. Here we go, y'all. Let me set this up. Oh my goodness, Kevin. What is going on here? It's all foggy. Oh man. Oh man. All right. I think everybody can see that. As a matter of fact, hold on a second. Whoop. Pretty sure my camera's all smudged and y'all are just like, Kevin, what the? Oh, that is so much better. Yes, there we go. Here we go. Hey, ladies and gentlemen, welcome. We are doing NCLEX questions. I'm just trying to get my life together right now. You guys already know we do these Monday, Wednesday, Friday, 5:30. And without further ado, here we go. And question number 1. A 65-year-old man who is a retired professional dancer has been admitted to the orthopedic unit for spinal stenosis surgery. He lives alone in a 2-story house and is concerned about his mobility and self-care post-surgery. Given his unique living situation and profession, which has contributed to his current condition, when should the nurse initiate discharge training and planning to ensure a smooth transition and recovery for this patient? Is the following surgery upon admission within 48 hours of discharge or pre-operative discussion? What are we thinking? You're going to work soon. That's okay. You already know you can find these on YouTube. What's going on, everybody? Hey, make sure you guys like, share, and follow. If you are new here, even if you're old here, make sure you like, share, and follow. All right. That's the trifecta that TikTok needs. If you're in nursing school right now and you're not sharing this with no one, you are wrong. And I want you to fix yourself. And I'm saying that nicely. Hey, I don't care who you're in cahoots with. And I don't care if you like them or not. I might like them. You know what I'm saying? So share. All right, y'all. Here we go. Here's our answer in 3, 2. You're in your last class. That's what I'm talking about. It says, I share, but they don't watch. Hey, if they don't watch, that's their problem. You do your part and you share. If they don't watch, hey, they can't, if they miss something, then hey, that's on them. But the answer is B. Upon admission, discharge planning is a critical aspect of patient care. If they miss something, then hey, that's on them. But the answer is B. Upon admission, discharge planning is a critical aspect of patient care. Question right. By the way, I got these questions off nurseslabs.com. Free sets of questions. You guys can go over there and check those out for yourself. All right. Hey, so I see somebody said that it's cutting off a little bit, so I'm backing it up. That's another reason why I'm reading it too. Hey, give me a thumbs up if you can see that. Give me a thumbs up if you guys can see that. Here we go. Question number 2. A 2-year-old child has been recently admitted to the pediatric unit following a minor accident at school. Whoa, Ryan. or Kyle, I'm sorry, Kyle passed NCLEX yesterday. Hey, everybody, you already know what to do. Kyle, congratulations. Welcome to the greatest shit show on earth, known as being a nurse, my good sir. If you give a piece of advice, what advice would that be to everybody here on this Friday? Congratulations to you. You are number one. You're the first one to come in here and tell us that. All right. So based on Eric Erickson's psychosocial development stages and the child's age and behavior, the nurse recognizes that the child is primarily navigating which developmental stage? Trust versus mistrust, initiative versus guilt, autonomy versus shame and doubt, or intimacy versus isolation. Who took it? Carson, you took it today. You're welcome. Shut off at 85. All right, Carson, cool. Come back on Monday and let us know how you did. What are we thinking, y'all? If you guys are wondering, I got these questions off of nurseslabs.com. They're both for RN and LPN, so you guys go over there and check them out for yourself. It says, thanks, y'all. I would say keep believing in yourself. Give yourself positive vibes only. Always give yourself positive vibes. Always, always, always. Words of affirmation, they mean a lot. Put it out to the universe and give it back. Give it back to yourself. Just stopping in and say thank you for these lives. Taking my NCLEX tomorrow. Oh, you're taking your NCLEX tomorrow? Brianna, what you doing on my live? Oh, okay, Brianna, you already know the deal. You know I'm going to kick you out, right? So go away and go hang out. Go away and go hang out. All right. And by say that, like, I don't want you here trying to cram. You need to be trying to relax as much as possible. All right. Go away and go hang out. All right. And by say that, like, I don't want you here trying to cram. You need to be trying to relax as much as possible. All right. It's a development of basic virtue. All right. That is part of psychosocial integrity, which is what is it? It's 6 to 12%. It's a smaller section on NCLEX, but of course still very, very important because that involves therapeutic communication, growth and development, so on and so forth. All right. So make sure you guys go and check that out. All right. Hey, can y'all still hear me? Obviously, I didn't pay my internet today, so I just want to make sure. Can y'all still hear me? Give me a thumbs up if you guys can still hear me and see me. Says Kevin, this is the best to end the dumpster fire I had. I bet, Anastasia. I bet. All good. All good. It's fine now. I don't know what's going on with the internets. I don't know what's going on with the internets. All right, cool. Here we go. Question number 3. A 26-month-old toddler has been admitted to the pediatric unit following a recurring episode of temper tantrums and refusal to eat certain foods at home. The parents are concerned and mention that the child has become increasingly assertive, often wanting to do things on their own, like dressing up or using the toilet. They also note moments that the child becomes frustrated and seems ashamed if they can't complete a task. Based on Eric Erickson's psychosocial development stages and described behavior, the nurse understands that the toddler is primarily navigating which development stage: trust versus mistrust, initiative versus guilt, autonomy versus shame and doubt, or intimacy versus isolation. All right, what are we thinking? Shout out to everybody that's in here rocking with me. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time we get to question 10, hey, questions are going to be done for this Friday. And y'all can just ask me questions and just look at my beautiful face. What are we thinking? By the way, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us tonight on this Friday? All right, y'all. We got some B's. We got some C's. Okay. Got some B's, got some C's. You guys got to remember, we learn about childhood development, especially like when you get into pediatrics, right? But then, hey, you still learn about all of the developmental factors from Erickson, especially when you're in like foundations and fundamentals. All right. I graduated this December. Shout out to you. Here we go. Here's our answer in 3, 2. And the answer is C, autonomy versus shame and doubt. For toddlers, specifically around the age of 2, the predominant stage is autonomy versus shame and doubt. That is psychosocial integrity. Y'all, I have a toddler. He'll be 2 in March, and my dude throws the craziest temper tantrums. I'm like, hey, I don't know where you got that from, but it ain't me. But you know, if you have those type of situations that happen in your life, you can apply them to trying to understand what these questions are asking you. So shout out to Sierra Leone, graduated in November. Okay, so shout out to y'all. Tiffany, I see you out there. Appreciate everybody participating. Here we go. Question number 4. A 20-year-old has been admitted to the hospital following a motor vehicle accident. During the assessment, the patient expresses concern about their recent breakup and how it might be affecting their overall well-being. They mention feeling isolated from peers and struggling with forming close relationships. The patient's parents also share that their child has been distracting or distancing from family gatherings and often spends time alone. So which developmental stage is that? trust versus mistrust, initiative versus guilt, autonomy versus shame, or intimacy versus isolation. What are we thinking? What are we thinking? Shout out to everybody. Hey, make sure if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. A little bit about me. Been a nurse for 3.5 years. I've worked ICU, OR, and I've worked PACU. Currently in school right now to get my master's in education. So shout out to everybody out there doing their thing. I appreciate you being here on this Friday, getting your learn on, especially if you're trying to prep for NCLEX, all right? Taking NCLEX in March. Shout out to you. I don't even know what your name is. I can't even try to. I'm not even going to try to say it. All right, here we go. Here's our answer in 3, 2. And the answer is D, intimacy versus isolation. For young adults, typically in their late teens to early 20s, the predominant stage is intimacy versus isolation. In this stage, young adults seek to form close, intimate relationships with others. Success in this stage leads to strong relationships, while failure results in feelings of isolation and loneliness. Once again, part of psychosocial integrity. All right. Psychosocial integrity, 6 to 12% on the NCLEX. A smaller section on the NCLEX, but still very much important. All right. So shout out to everybody that got that question right. If you guys, of course, have any kind of questions, you guys drop them down in the chat, and you guys have conversations amongst yourselves, help each other out. Remember, everyone is in a different place in their nursing journey. All right. So I need everybody to respect the fact, hey, if you get it wrong, that's okay. But remember, you need content, Q&A, rationale, so you guys can get it. All right. Question 5. During a school health fair, a nurse is stationed at the vital signs booth. As students from various age groups approach, the nurse takes their vital signs. Later, while reviewing the recorded data, the nurse identifies one set of vital signs that seem abnormal for the age group. Which of the following vital signs taken during the health fair appears to be outside the typical range for the prospective age group? What are we thinking? Is it A, an 11-year-old athlete who just finished sprinting, has a 90 of a heart rate, 22 respiratory rate, 100 over 70 for blood pressure? A 13-year-old who mentioned she was feeling a bit anxious about an upcoming exam. So her heart rate is 105, respiratory rate 22, blood pressure 105 over 50. A 5-year-old with 102 as a heart rate, respiratory rate of 24, and a blood pressure of 90 over 65. Got a bunch of people screaming B at me. Okay. A 6-year-old with a heart rate of 100, respiratory rate of 26, blood pressure of 90 over 70. 14-year-old with a 85 heart rate, 20 respiratory rate, 110 over 70 for blood pressure. Or is it a 12-year-old with an 88 heart rate, 18 respiratory rate, and 95 over 60 for a blood pressure? What are we thinking? Let me give you guys a little bit of time. This one's a little bit long. Hell, it was long for me to read. I don't know. I think it's A. Okay. All right. So this is where we had to know what are the normal vital signs for each age group. Like for our infants, do we want our infants having heart rates that are like in the 60s? No. Newborns? No. Do we want to see somebody like, that's older? Do we want to see what them heart rates being in the 100s? No. All right, y'all. Here we go. Here's our answer. In 3, 2. And the answer is B. A 13-year-old female who mentioned she was feeling a bit anxious about an upcoming exam, and her heart rate being 105, respiratory rate 22, and a blood pressure 105 over 50. The normal range of vital signs for an 11 to 14-year-old: heart rate 60 to 105. Respiratory rate 12 to 20, and a blood pressure systolic 85 to 120, diastolic 55 to 80. Body temp being 98 degrees Fahrenheit to 96. The client's diastolic blood pressure is lower than the normal range. Both her respiratory rate and heart rate are slightly increased. That is part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. 9 to 15%. It's actually the 4th largest section on the NCLEX. So once you understand how the questions are asked and what category they fall under, it'll be no new news to you. All right. So shout out to everybody that got that question right. Ladies and gentlemen, hey, if you're looking for some free test taking tips, check them out. I got them over there on my website, over there at thebootnurse.com/test. Hey, I have an ebook over 700 pages to include EKGs, pharmacology, management of care, delegation, both for RNs and LPNs. You guys can check that out. Also linked in my bio. bootnurse.com/victory. 7-day NCLEX course. It's yours forever, or for however long you live. Whatever comes first. And of course, if you're one of those individuals who's taking the NCLEX, you're nervous, don't know where to begin, you've failed multiple times, you just don't understand what the questions are asking you, I do coaching for that. All those links are in my bio. You can check that out. bootnurse.com/coaching. All right, here we go. Question number 6. You are conducting a comprehensive assessment of a 38-year-old female patient in the outpatient psychiatric clinic. She mentions that she has been struggling with both depression and an anxiety disorder for several years. She hints at being on medication but doesn't remember the name. As you review her medication list, you notice a drug that is commonly prescribed for such conditions. Based on her symptoms, which of the following medications on her list would she most likely be taking for her depression and anxiety? What do we got? What do we think? Got A. Okay, we got A. Definitely A. Okay. Got some people that are some solids on there. Hey, real quick. Hey, we're on the road to 10,000 likes. Make sure you guys keep smashing that like button. You guys share, you guys follow. We're doing NCLEX questions, both for RNs and LPNs. Hey, did you guys know that RNs and LPNs learn the same content? So if you're an LPN, just know that you learn the same exact content that an RN learns. You just need to know what you can and can't do as an RN. We learn the same content. There's just certain things you can't do because of scope of practice. That's it. Thank you, Brittany, for the heart. I appreciate you. Here we go. But here's our answer. Here is our answer in 3, 2. And the answer is A. Amitriptyline. I was like, man, I forgot how to say it. Amitriptyline is a tricyclic antidepressant and used to treat symptoms of depression. That is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 14 to 18%. So shout out to everybody that got that right. Remember, when you guys are studying, you need content, Q&A, rationales. If you get it wrong, guess where you're going? Right back to the beginning. I call that a full Boot Nurse 360. Get that ass right back to where you were at the beginning so you can continue to learn on why you got it wrong so you don't get it wrong in the future. Yeah, tell the hospitals and RNs I work with. Well, hey, I'm not telling your hospitals and your RNs nothing about what about anything. I'm telling you, based off of the book, you learn the same content. You learn the same content. So it doesn't matter what they tell you. It's just like that is what the doctrine is. That is what is in the book. You learn the same stuff that we learn, but there's certain things you can't do because of scope of practice. Here we go. Question number 7. A nurse is reviewing the medication list of a 45-year-old male patient admitted to the medical unit. The patient has a complex medical history to include recent diagnosis of bacterial respiratory infection, a past episode of Legionnaire's disease, a family history of, Camptolo, a past episode of Legionnaire's disease, a family history of, Campylobacteriosis infection, the multiple sclerosis, history of atopic pneumonia or recent exposure to a patient with pertussis. What are we thinking? What happened? What happened? Did my live cut out again? It's lagging? Oh, man, I don't know what's going on today. You were in and out. You hear me? Man, I don't know what's going on. Yes, it cut out. It got paused. You can hear me? Hey, give me a thumbs up, y'all, if y'all can hear me. Hey, this is the first time I ever had this happen, so I'm just trying to work our way through it. Let me see. Let's see what we got. All right, y'all. I'm going to go over to the answer. I'm going to let everybody start coming back in. But here we go in 3, 2. And the answer is D, the long-standing diagnosis of multiple sclerosis. Erythromycin is an antibiotic used to treat various bacterial infections, including bacteriosis. Oh my God, bacteriosis. Infection, Legionnaire's disease, and certain types of pneumonia. It is not used to treat multiple sclerosis, which is an autoimmune disease affecting the central nervous system. Once again, that is part of pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam at 14 to 18%. All right. So shout out to everybody that got that question right. I don't know what's going on with the interwebs tonight. Maybe it's just like, hey, bro, get off, take a break. So everybody's still with me. So I'm glad y'all still out here rocking with me. Here we go. Question number 8. A 58-year-old male patient has been admitted to a cardiology unit following complaints of palpitations and fatigue. Upon reviewing his medical chart, the nurse notes a history of chronic kidney disease and a recent episode of hyperkalemia. The patient describes a variety of symptoms he has been experiencing over the past week. Based on his history of hyperkalemia, which of the following symptoms reported by the patient would the nurse consider unrelated to an acute episode of hyperkalemia? What are we thinking? So remember, if you can't remember with hyper and hypokalemia, kalemias do the same as except for heart rate and urine output. Think about it like that. They do the same as the prefix, except for heart rate and urine output. There, I just gave you a trick. It says all of them. Okay, all right. Definitely B. Okay. All right, y'all. I'll give y'all 10 more seconds. 10 more seconds. Hey, if you're new here, welcome. Welcome. We're doing NCLEX questions. Got them off nurseslabs.com, both for RNs and LPNs. RNs and LPNs. All right. I want to know who you are, where you're from, where you're at in your nursing journey. All right. Here we go. Here's our answer in 3, 2. And the answer is D. It's migraines. Hyperkalemia or elevated potassium levels in the blood can manifest with various symptoms, including cardiac disturbances like a decreased heart rate, paresthesia, which is tingling sensation, and muscle weakness. Migraines or severe headaches are not typically associated with hyperkalemia. That is physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. See, I knew I was going to say it at one point, but 11 to 17%. All right. Hey, that's the third largest section. Management of care is number 1. Pharmacology is number 2. Physiological adaptation is number 3. All right. So shout out to everybody that got this question right. You love school? You calling me school? I don't know what that means. Here we go. Question number 9. A 42-year-old female patient with a history of type 1 diabetes presents to the emergency department with complaints of fatigue, increased urination, and difficulty breathing. The nurse suspects an acute episode of ketoacidosis based on her medical history, and current symptoms. As the nurse continues the assessment, the patient describes various symptoms such as being, have been experiencing over the past few days. Based on the potential acute ketoacidosis, which of the following symptoms reported by the patient would the nurse consider atypical for this condition? Is it persistent nausea leading to episodes of vomiting, insatiable feeling of thirst despite drinking large amounts of water, a noticeable increase in weight over a short period, or a distinct fruity odor of her breath? What are we thinking? Shout out to all 412 of y'all out here rocking with me. I appreciate y'all. We're doing NCLEX questions. Got them off nurseslabs.com. I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, what are you doing here rocking out with us? What are you doing in here rocking out with us? Let's see. We got some C's. We got some A's. TikToker said, I'm a nurse attorney. Who's a nurse attorney? Shout out to Australia. Shout out to my x-ray techs. Okay, I see y'all out there, not a nurse, medical assistant. Shout out to you. Hey, you may end up wanting to be a nurse. You take your NCLEX February 16th. Shout out to you. RN Texas School. Okay, shout out to you, user 98. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is C, weight gain. Diabetic ketoacidosis is a serious complication of diabetes that occurs when the body produces high level of blood acids called ketones, right? Common symptoms of DKA include nausea and vomiting, extreme thirst, frequent urination, and a fruity scented breath. Weight gain is not typically associated with acute DKA. In fact, weight loss might be more common due to the body's inability to use glucose for energy and the subsequent breakdown of fat stores. That is part of physiological adaptation, which is what? Physiological adaptation is the third largest section on the NCLEX at 11 to 17%. I'm a CNA, but I want to be a nurse. All right, is it Reese? Hey, you want to be a nurse? Put in the work. Put in the work to get there. You can follow in the footsteps just like everybody else, and I know you can get there. Cardiac nurse here, Wisconsin. Shout out to you. Thank you for the heart. Oh, Sarah. Hey, my other mom is in here, y'all. Sarah, SSH Mentoring. That's my other mom. I love her. I appreciate you. One of the best mentors ever. Here we go. Question number 10. A 28-year-old patient presents to the emergency department with a sudden onset of severe headache, stiff neck, and confusion. Read between the lines, y'all. All right. His roommate mentioned that the patient had been complaining of flu-like symptoms for the past few days. Given the patient's presentation and the information provided, the nurse suspects acute meningitis. As the nurse continues the assessment, the patient, though disoriented, tries to describe some of the symptoms he has been experiencing. Based on the suspicion of acute meningitis, which of the following symptoms reported by the patient would the nurse consider not expected in this condition? So find the ones that are expected with meningitis, and then the ones that don't fit are your answers, all right? So a sudden increase in appetite over the past 24 hours, episodes of vomiting, especially in the morning, high fever and chills, sensitivity to light, preferring to stay in a dark room, muscle aches and joint pain, or ringing in the ears. What are we thinking? A, 100%. Okay. All right, cool. What else we got? Shout out to all 300 plus of y'all. I know my reading is taking a while, but a lot of people like the fact that I read, so if you don't like the fact that I read, then, I guess you can mute me, but whatever, But I love y'all. I appreciate y'all being here. Sierra says F. I see you, Sierra. All right, here we go. Here's our answer. I like your strategy. I appreciate you, sir. I appreciate you. Here we go. Here's our answer in 3, 2. And the answer is A, sudden increase in appetite over the past 24 hours. Loss of appetite would be expected. Loss of appetite will be expected, not an increased appetite. Most cases of meningitis are caused by an infectious agent that has been colonized or established in localized infection somewhere in the host. That is physiological adaptation, which is the third largest section on the NCLEX exam at 11 to 17%. So shout out to all y'all. I got that right. Like I said, once you start to understand, like you have trauma, acute, you have chronic, physiological adaptation consists of a lot of pathophysiology, disease processes, how they work and how they affect the body. Once you understand where they fall, it's no new news to what the questions look like. All right.